Thank you. I now recognize Dr. Redfield to give an opening statement.
Chairman Winthrop, Ranking Member Reese, and members of the committee, I'm pleased to testify today in support of this subcommittee's important work to investigate the origin of COVID-19 that has resulted in the deaths of over 1 million Americans. From 2018 to 2021, I served as the 18th Director of the Centers for Disease Control and Prevention during the Trump administration. As CDC Director, I oversaw the agency's response to the COVID-19 pandemic from the earliest days of its spread, and I also served as a member of the White House Coronavirus Task Force. But perhaps more relevant for the purpose of this hearing, my 45 years in medicine have been focused on the study of viruses. I'm a virologist by training and by practice. Prior to my time at CDC, I spent more than 20 years as a U.S. Army physician and medical researcher at the Walter Reed Army Institute of Research, where I served as the chief of the Department of Retroviral Research, and I worked in virology, immunology, clinical research at the forefront of AIDS epidemic and other viral threats. In 1996, I co-founded the Institute of Human Virology at the University of Maryland in partnership with the state of Maryland, the city of Baltimore, and the University System of Maryland, where I served as the Director of Clinical Research and Care, and I also served as a tenured professor of medicine, microbiology, and immunology, Chief of Infectious Disease and Vice Chair of Medicine at the university. After my time at CDC, I served as the Senior Public Health Advisor to Governor Hogan in the state of Maryland. As COVID-19 began to spread across the world, there were two competing hypotheses about the origin of this virus that needed to be vigorously explored. The first hypothesis is the possibility that COVID-19 infections in humans were the result of a spillover event from nature. This is a situation in which the virus naturally mutates and becomes more transmissible from one species to another, in this case from bats to humans via an intermediate species. This is what happened in previous outbreaks of SARS and MERS and earlier coronaviruses that emerged from bats and spread through an intermediate animal. The second hypothesis is the possibility that the virus evolved in a laboratory involved in gain-of-function research. This is a type of research in which scientists seek to increase the transmissibility or pathogenicity of an organism in order to better understand that organism and inform preparedness efforts and the development of countermeasures such as therapeutics and vaccines. Under this theory, COVID infected the general population after it was accidentally leaked from a lab in China. From the earliest days of the pandemic, my view was both theories about the origin needed to be aggressively and thoroughly examined. Based on my initial analysis of the data, I came to believe, and I still believe today, that it indicates that COVID-19 more likely was the result of an accidental lab leak than a result of a natural spillover event. This conclusion is based primarily on the biology of the virus itself, including the rapid high infectivity for human-to-human transmission, which would then predict rapid evolution of new variants, as well as a number of other important factors, which also include the unusual actions in and around Wuhan in the fall of 2019, all of which I'm happy to discuss today. Even given the information that surfaced in the 3 years since the COVID-19 pandemic began, some have contended that there's really no point in investigating the origin of this virus. I strongly disagree. There is a global need to know what we are dealing with in COVID virus because it affects how we approach the problem to try to prevent the next pandemic. The understanding of the origin of COVID is critical to future science research, particularly as it affects ongoing ethical debate around gain-of-function research. Gain-of-function research has long been controversial within the scientific community. In my own opinion, COVID-19 pandemic presents a case study on the potential dangers of such research. While many believe that gain-of-function research is critical to get ahead of viruses by developing vaccines, in this case, I believe it was the exact opposite. Unleashing a new virus to the world without any means of stopping it and resulting in the deaths of millions of people. Because of this, it's my opinion that we should call for a moratorium on gain-of-function research until we have a broader debate and we come to a consensus at a community about the value of gain-of-function research. This debate should not be limited to the scientific community. If the decision is to continue with gain-of-function research, then it must be determined how and where to conduct that research in a safe, responsible, and effective way. I thank you for inviting me here today. As we explore this important topic, I look forward to answering your questions. Thank you.